Good evening. On behalf of the Plymouth Area League of Women Voters, I welcome you to tonight's program, A Healthy Plymouth, Prevent, Promote, and Protect. Our speaker, Dr. Nate Horwitz-Willis, began his responsibilities as Plymouth's first professional director of public health last August, less than a year ago. He quickly and effectively has reached out to the community, welcoming input and support from many corners. His charge, to lead Plymouth into the 21st century of local health initiatives. Concurrently, he also serves as a captain and public health officer in the Air National Guard on Cape Cod. Here is Dr. Nate.
Thank you very much. I really do appreciate it. And I'm always humbled when I'm speaking in Plymouth because I really do feel and believe that there are a lot of people that want to see a lot of good things happen, and they're very smart and intelligent, and I like to refer and sometimes even defer to that expertise in the community because I believe that's how public health really gets strong, is engaging with the community and bringing you all in so we can be a part of this to figure this out because it's not about me. You'll always hear me say that, and I really do want to make sure that Plymouth benefits from my service, but as well as from your input too as well. So with me saying that, tonight's, I won't call it a speech, but I'll call it a discussion. So if there's ever at any point or time that you want to raise your hand or you just want to, speak out like you're talking to me, like we're having a regular conversation, please do so. So I don't want to talk at anybody tonight at all. But I will definitely be talking about some of the things that we're doing here in the town of Plymouth for public health because it is new to a lot of people. A lot of people didn't even know that we existed. And I am doing a lot of stuff. I've only been here for 10 months, but I feel like I've been here for 10 years. That's too bad because there's been a lot of things that I've been tasked to turn around and really get out in front of, and that's what we're going to talk about tonight. So public health, though, for most people, they think it's about responding and reacting to an outbreak or a disease all the time. But public health really is about being proactive and focusing on prevention. There are 3 stages of prevention: primary, secondary, and tertiary. Public health itself is responsible or principally concerned with primary and secondary prevention. And that means education, screenings, getting out there and having a discourse with the public and connecting, and then trying to understand some of the perceptions and susceptibilities to prevent the disease. And the disease usually occurs in that tertiary or the 3rd phase. And that's where the healthcare system really comes into play a lot, so that we can rehab people and get them to recover. But since we've been blasted into obscurity, sometimes there's been some confusion as to what we're trying to do in the town of Plymouth. And that leads me to say that across Massachusetts, we have 351 towns deemed as municipalities or cities or even districts when we're talking about public health. And that means public health could be very different for whichever town you're talking about. Within Plymouth, we have unofficially, as I've been talking to the people, I found out that we have unofficially 67,000 people in this town. And we're huge. We're so far spread out. In order for me to do anything in the town, I'm usually packing up my suitcase and getting ready to head across over to the other side of Plymouth, and it takes me 20 minutes to get somewhere. And in our tiny department, I have to really take into consideration the resources that we have. And usually when you're taking into consideration the resources, you have to look at who's leading the department. And so for us, as Mary pointed out, I am the first professional director of public health here in the town of Plymouth. My background enables me to function very efficiently, I believe, and to also understand how to allocate resources and leverage technology. That's one of the big things that I'm really looking forward to doing more and more of, is leveraging that technology. However, other towns aren't as fortunate because some people don't have that type of background in that leadership capacity. And in some towns, they may have different leadership at the very top that may consist of a building commissioner. It may even mean that a fire chief may be leading that charge. And then the Board of Health and Public Health Department are sometimes mixed up in the sense meaning that your Board of Health is an elected board that may actually be running the operations and the regulatory aspects of public health. Here in the town of Plymouth, we're extremely lucky to have a Board of Health that understands the regulatory pieces and how to marry that into the enforcement, which is principally what I'm concerned with. And we have this symbiotic relationship in which we work back and forth to understand how to get things done. So, with that being said, I've had people come to the office like, is this the Board of Health? And I've had to be very clear in saying that the Board of Health is a group of individuals who work with me to get things done. They establish policy and regulations. And one of the unique things that we're trying to do is establish evidence-based policy and regulations that protect a lot of the resources here in town that's going to benefit you all. That's the beauty of that. So I don't have to wear all these different hats sometimes, and I'm very fortunate to have board members that work with me that look at the policy and say, Nate, is this really effective, and why are we doing this? So we can try to achieve certain things. And like I said, you go to another town next door, it may be completely different. But here in, I like to say sometimes the city of Plymouth, even though officially we're not, we have a luxury to really look at things in a proactive approach as we continue to grow, because we need both the board and the public health department to function together to tackle a lot of these new and emerging problems that we're starting to see. So what does a public health system even look like? So public health system is exactly this. And as I really hampered upon the board and public health relationship, I'm really trying to leverage those two things. I'm extremely excited about the future and what it has to hold. In my 10 short months, I've been able to reach across different sectors across the community that have been very surprised that I'm here, and we're making a lot of strides. Some of the things up there, some people wouldn't think that public health would ever be involved in. And I don't blame them, because before I started really getting engaged in my own academic profession in research, I didn't know that public health really did this much. We really move the needle on a lot of things, and we do it at an extremely low cost or no cost at all. So we actually deliver a lot of benefits to a municipality, and I'm trying to make sure that you all can realize them. And it moves slow sometimes. That's the unfortunate thing about being proactive. You really don't realize it, or you don't even know that it's happening. But with me being able to engage with you all, I can talk about some of those things, the benefits, as I will talk about here very shortly. So when I first got here in the old town hall, I was wondering, who do we engage with? Who are the people in the community that are really going to be responsive to help me move the needle toward prevention and positive health outcomes across the entire population, from the infants and babies to early adolescent to young adult to elderly adult, and even to the transitory phase of your next life. I think that's a pleasant way to say that. So when I got here, I was really wondering who would be the key stakeholders. And we really didn't have that many. We had some champions, which is good, but no one knew how to approach us. And so I was always out and about, just because I'm a public health purist at heart. I love public health. Like, I really love my job so much. The town manager's like, you gotta watch it. You can't go out too much at night. I don't want you to get burnt out. But I do. I love what I do. And in my little short time span here, these are some of the collaborations that we just started to really focus on and bring to light. The Plymouth Public Schools have been extremely helpful. The 105 CMR, that's Code of Massachusetts Regulations, identifies that you should have someone from the board or public health department to sit on that to address adolescent health factors, and to use data to do that, and to design programming around health promotion, prevention, the whole gamut when we're talking about public health. And one of the other things I want to highlight here is the PYDC, which also focuses on adolescents. It's not relatively new, but the notoriety of this group is really starting to get out there. They primarily focus on substance abuse and substance use education, and what I do with them is I serve as an advisor in my public health role, and we're really getting out there to talk about drug use amongst adolescents and how do we really prevent that. But yes, the Plymouth Youth Development Collaborative. Yeah, thank you. So please feel free to interject and ask questions like that. I really appreciate that, because sometimes I'm military too, so I don't think about acronyms that much. So we get together and we work in tandem to address key problems that people in the community may know more about than I do. So I'm getting data through anecdotal type ways that I can't get if I was just sitting in my office trying to mine the data through a CDC or the MDPH, Massachusetts Department of Public Health website. They've been a very key and instrumental resource. We meet usually once a month on the first or second Friday of the month, depending on how it's falling. So for example, we're not meeting this Friday, but next Friday we'll be meeting. So this collaboration has been really spearheading some of the opioid issues and also vaping. If you guys have been following Twitter, my little Twitter feed that I have, the vaping issues. And I want to say that we've been able to get adolescents involved because they never historically or traditionally, have had a voice in the town. They were able to essentially say, hey, Board of Health members, we have an issue with the vaping laws, and we want to protect our health. No one's ever listened to us. We had one of the largest turnouts ever in the Board of Health, I think, in the history. The room was packed, and it was a testament to showing how when I can engage in the community and when the Board of Health is receptive, we can make a move and get things done. And that's one of the things I definitely want to leave as a key takeaway, is that everyone should know that you can come to the Board of Health and voice your concern and know that the Department of Public Health here in the town is going to work to get it done. I really want to make sure that that is a huge message that I'll leave you all here with. Now, the fire department I put up because what we've done is we looked at needle disposal in the town of Plymouth, also with the police department. We have a very fragmented needle disposal system right now. You have to pay almost about $35 a pop to send off needles. If you keep doing that recurringly, and if you can only put in 20 to 25 of them, that adds up really quick. I estimated that we could see about maybe 300,000 needles. That's an ultra-conservative amount per year in the town, because that means that if you're a diabetic user, or if you have animals that need vaccinations, or if you're using drugs and you may have other family members that come in town that have medical issues, you're stacking up these needles, and then we have a hoarding issue, and then you're being exposed to disease such as hepatitis C. So hepatitis C in the town, unfortunately, has been strongly correlated with needle exposures such as this, in tandem with the opioid epidemic. I haven't published that data just quite yet because there's only one of me, and now I have 5 bright young students who are going to help me publish some of that data so you all can really see what's going on, not at the end of the year, but hopefully quarterly at a minimum. So that's a new service that I'm going to try to provide to make sure you guys see that stuff. I'll brag on the students a little bit later, but the PCO, the Plymouth County Outreach, I also sit on their advisory committee as a public health advisor. So we're working across about 27 towns and cities in Plymouth County alone. So what I've been able to do with them is advise them on evidence-based practices and also give them a little bit more pointers in terms of prevention on the primary and secondary side of the house. The police historically in Plymouth have not worked with someone in this capacity or this role. So the perception of police is, albeit right now, a negative one across the country, and that's really unfortunate. But I can assure you all that this group really wants to try to turn that tide and look at community policing and look at how to implement public health practice into that. So I got to give kudos out to those guys. I'm very appreciative that they're receptive to having someone come in on their turf and being able to advise them on these issues here and using other methods and tactics to reach people and curb opioid use. So Walmart is up there because Walmart just recently approached me and talked about having some ways to go out into the community to affect change in the areas of infectious disease. I am proud to announce that we will be doing 4 community health clinics to do vaccinations across Plymouth. We'll be looking at North Plymouth, we'll be looking at Menomet, the Pine Hills, and also South Plymouth. So that's huge because we've never been able to have that kind of reach. I made a joke, but it's a good statistical one, that we had a 7,000% increase in being able to administer vaccinations this past year in November. Well, the year before that, we didn't have this type of clinic, so there were 0. So we had 7 show up. So the number looked really good. So you know what they say about statistics, and so but this right here will have a far bigger reach, because when I looked at the data, and I say all this stuff will be published to you all because there's going to be some things that you didn't know were happening across the town that we all should be knowing about. But when I looked at the data, I was able to look at some of the vulnerable areas around town by precinct. And this is where Walmart will come into play. We'll be able to go to some of these vulnerable areas and be able to provide vaccinations to them, because I'm on a transportation collaborative right now to where we've identified areas Plymouth to where people aren't able to access adequate transportation, and Gatcher's sitting on there too. So I don't want to paint Gatcher as a bully or a bad person, but they recognize the issue too. So we're trying to get together to figure out innovative, strategic ways to get them to have access to care. So that's going to be really huge, and to have Walmart be involved in this is a testament. Excuse me. So very good question. We're going to have it for all age ranges. All age ranges, they'll be able to help administer all vaccines that are very pertinent. And so the beauty of it is that they're going to be able to make sure that no one's going to have any type of contraindications or health issues when they administer a vaccination. Currently, I don't have that capacity to do that in the department for other reasons unknown. We can get into that later if you want. But the point being is that they're going to be able to provide this health service that was never able to be provided, and it's at zero cost to the town. That's a huge benefit.
Who's paying for it?
So the person's health insurance will pay for it, and if there are any other circumstances that we find out that the individual's not going to be able to pay for, Walmart's going to work it out. So we've come to an agreement. We're going to work out those details, but this is zero cost to anybody. So long as you have health insurance, you're going to be covered. Yes. So that is a very good question, because we had that conversation, a very candid one, very productive, candid conversation, and I asked the same question. And the answer I got back is that Walmart recognizes that they want to partner up with communities who have a public health vision to really achieve optimal health outcomes. So they're reaching out to other towns and municipalities to really look at putting in other infrastructure. So I'm originally from Arkansas. I don't know if you can hear my twang, but and that's hometown city for Walmart. And in my town of Conway, Arkansas, what Walmart has done is they put in infrastructure for bike trails, and they've also been able to put in money into the cities and towns and make sure that they can connect those trails. The caveat is the trail usually runs by Walmart if you're on your bike, if you're on a run. But I've seen it done, and this is one of the things that we may engage in and seeing how our relationship develops. So there are other potential benefits to this relationship, and Walmart recognizes it. Yes?
Will there be even arrangements made for the shingles vaccine, which is very expensive and not covered by most insurances? How does that work?
So we did talk about that, and the individual that I engaged with, who's a pharmacist, brought that up, and the language that was used with me is that they understand in the population that we're working with that this will be an issue, and they want to address it, and for them, they want to try to do their best to cover it. So even with that, they're telling me that that should not be a problem. Yes, so this is, even though I realize that I'm being broadcasted, right now that's unofficial as we actually work that out. So I will make an official statement that will have those concrete parameters in there. So more to come, and then we're going to commence this in October, starting in October. So early October, late August.
How will we learn about the data that you publish? You mentioned you plan to, for insurance, publish data and as you find it. What will that be? Will it look like a newsletter? Will it be a newspaper article? Or?
So the way I like to run things is that I want input. So yes, say we put it out on a newsletter and it looks nice and pretty, but people are like, well, I want it on the fly and on the go. It's like, okay, well, how about you provide us your cell phone number or your email, and we send you a bulletin, a reminder as a subscription service right then and there so you can access it. So that's how I'm trying to really leverage that technology. So that way, if you guys care about it that much, then I can automatically send it to you. You have access to it rather than you having to go hunt down information in a website that's convoluted. I don't believe in that. Yes. So, oh, yes.
One more thing on the subject of vaccination.
Absolutely.
Do you keep statistics about the rate of vaccination of, say, homeschool children and children that are not in the public school system?
So the way that is done is Massachusetts Department of Public Health, they'll get that data, and I can get access to that, and I can start to put that out. But also the unique thing is, I'm glad you made me do this or say this, is that with Plymouth Public Schools, the school health services director and I, we've talked, and what we've done is we've got our data sets and we're putting them together, and we're going to be able to look at that data. So we'll be able to know in terms of the schools who has what and in what community. So if there's ever an issue, since the schools are neighborhood-based, we'll be able to pinpoint why there may be an outbreak or be able to closely monitor that. So we're going to have proactive, active surveillance going on for our adolescents, but also for the adults. We'll be able to have that information for communities in Plymouth from DrPH, although that data is not necessarily much real time because the doctor's offices, physician's offices will submit that sometimes in a lag period.
Two-part question. Do you know how many uninsured residents there are in town?
I don't have that data quite yet, although I can get that, but do you know any information?
No, I
Oh.
don't. I thought you were implying, and this is the second part of the question, that Walmart, for those individuals that are not insured, will work out an arrangement where they get the vaccination, but does that mean that they're also going to be having to pay a cost?
Yes, there could be a cost associated with it. It will be low, so meaning it will be subsidized. So the person will not be paying hundreds of dollars. That won't happen at all.
We need that thing, the other mic for people, so when they, portable one, when they ask questions.
Oh, okay, got it.
for TV,
So I will,
there.
where's it at? I was gonna say I will stall for a second if we need to.
No,
Which one is it?
it's over here.
Oh, the big one, okay, got it.
All right, so raise your hands and then I'll come by.
But no, in terms of the question for the uninsured, a little bit more, we don't know that number quite yet. Although I can get access to the secondary data for claims data, and we can start to see what that is looking like. And like I said, I wasn't able to do that because I didn't have the personnel. But I think we need to know that information because if we see the number of uninsured in our community, we all know that when we have a high number of uninsured, that really impacts healthcare costs, and then it has other implications in our society for public health and other costs that are associated with lack of care. So I'll continue on with the other institutions that I have here. So Massachusetts College of Pharmacy and Health Sciences and the Harvard collaboration that's going on is extremely huge for the town of Plymouth for public health because we're starting to get more intellectual capital at an earlier age so that we can create a pipeline and have students come in and really work to improve the public health system for the town of Plymouth. Because one of the things that I've started to see is that we're going to have a huge problem in the area of cognitive. I like to say cognitive health because I don't think when we're talking about mental health, we don't need to stigmatize it, and I think we probably should consider a better word, but that's just my opinion. But what's happening is that it's becoming a top leading cause of death in the town of Plymouth. Surprisingly, it's amongst people who are much younger than you would think. We're talking about 45-year-olds, 50-year-olds, people who you wouldn't think would have these problems. Are we really equipped to deal with them from a public health standpoint? The honest answer is no, we're not. I'm trying to work on developing programs to talk about doing these things in terms of being preventive. That will take some time to get to, but I bring up these institutions because they actually have resources that they can give to the town of Plymouth Public Health Department to really look at addressing those things. So MCPHS specifically, we're in talks to create a academic public health department pipeline, which will allow students to come in here and do practice-oriented experiences similar to like a clinical rotation. So I call it a public health rotation, in which we will always know we'll have a cadre of young talent coming here to the town of Plymouth, bringing in more young energy, and then also contributing to the economic boom. So if any board of selectmen are watching this, I hope that I get a pat on the back one day for this. And the Harvard is relatively new as we're collaborating with some of their students because we're looking at more advanced problems here. So one of the big problems I always get, and I look over here in this area because water is a huge issue in the town of Plymouth. That's one thing that I am actually having as one of my top priorities, is the built and also physical and natural environment. And we have some vulnerable water issues that are going on here. And I must say that the town manager and I, we did engage in a conversation today, and she wanted to be known that she understands that water is a hot topic, and she wants to make sure that it's at the forefront, and she wants to make sure public health is involved in that. And I have a really close relationship with David Gould, Marine and Environmental Affairs Director, to try to tackle some of these things. So I go back to the interns. So the interns will be able to go out and do some sampling with, for example, the EPA or the DEP and Marine and Environmental. We'll be able to analyze this data and try to get it back at a quick turnaround time. As you can see, what I'm trying to do is I'm trying to tailor public health for the town of Plymouth. All too often, we get a lot of data from the CDC. We look at county level data, and counties really don't have a lot of weight in Massachusetts. So the towns really speak volumes, and we don't have good town level data that we're pushing out to the people so that way you all can understand what's happening. Effectively, I think I'm leveraging these collaborations to try to do that, and hopefully I can get to more improved outcomes that you all will be able to see. If you don't measure it, you really don't know what's going on, and nobody starts to care about it, and then you can't even get funding for it. So I'm trying to make sure I actively capture that and really match it up to what's called Healthy People objectives. So Healthy People 2020 is like a national standard that's already out, and if I try to meet that standard, I won't meet it because it's going to be up in, 2 years almost. So I'm looking at Healthy People 2030. That's going to be the next standard. So that means I should expect to be here for another 12 years to see things come to fruition. But these collaborations are extremely huge here for us to keep trying to get to some good outcomes and for you all to realize and experience better health outcomes in the town. So now the future of public health across Massachusetts is really looking to change. I had the opportunity to talk about this in brief in my my Board of Health meeting, and then my students, they are exposed to this, so they know what we need to be doing to try to improve things in our public health department. So I bring this up because this has serious implications for how public health is implemented in a municipality. So that means the governor, he has eyes on this. Also the MDPH, Massachusetts Department of Public Health, commissioner has eyes on this, and I'm interacting with other people who are really trying to lead the charge to make sure that we change public health from being only looked at as an inspectional model, because public health is so much more than going and looking at something and doing a checkbox. We have to evaluate, we have to interact, we really have to plan and strategize and also make up new policies, because there are many new changing times that are coming ahead. So someone told me at an advisory finance meeting, I won't name his name, but he had said that the MGL is a mess. It's hard to read and interpret and understand. And if we have good local regulations, then we can actually have stuff that's easy to understand and interpret, so that way we can have good functioning cities. As it stands right now, I will be the first to admit that some of the things for our public health department aren't adequately written. However, the board is very aware of that, and they're looking to try to do some new and innovative things with policy. So that's really exciting for me, because like I said, they were exposed to this, they took it home and they read it with them, and there's actually 3 tiers of public health. One tier is called Public Health 1.0, and then there's 2.0, and then there's 3.0. So 1.0 is the inspectional type model. You know, you want to try to prevent any outbreaks and focus on infectious disease. The 2.0 is, we need to review our policies and try to understand what we're doing and how do we move the needle for certain health outcomes. And then you also want to prevent outbreaks and infectious disease. And the 3.0 is this. And then it's also looking at what's called social determinants of health. I'll get into that a little bit later, but you're really looking way far ahead, and you're not looking at a reactive model of public health. So if anyone is interested, let me see if this is going to work. If anyone is interested to learn about where public health is going, there's these listening sessions that will be held across Massachusetts. So you'll be able to sit in and listen in terms of what's going to be done with this public health report for local and regional public health across Massachusetts. You may even be able to make a comment about it. But this is how public health, the new public health, will be determined for the most part. If you want to find me and get information on this or have me email it to you, I will be more than happy to email you this and also email you a link to the report as well too. see here. Oops, okay. I see this is always, I have no luck on this. There we go. So now this leads me to something extremely important in terms of where does Plymouth fit in public health. So there's these things called the 3 core functions of public health and then the 10 essential services. So you have assurance, assessment, and policy development. Those right there you have to have as your foundation in order to really have an optimally functioning public health system that encompasses your board and also your department. And then in the nice colorful pinwheel, we have those 10 essential services. So as I'm going through the day-to-day and trying to make sure that we're really optimally functioning very well and looking ahead, in my mind, this is what is turning. Yes, it's a wheel, so yes, the wheel is turning in my head, and this is what I'm really thinking about right here. Some things, if I had to fill up the wheel, some things are getting filled up more than others. Some things we haven't even gotten to yet. And in all reality, right now, what we're really doing and focusing on is enforcing the law or regulations that we have right now. We're looking to develop better policies. Very recently here, we're mobilizing new community partnerships, as I identified earlier. I even think this would be considered relatively new because you all are stakeholders, and I hope to be working very closely with you if you're a town meeting member or you have your own organization or if you're a concerned citizen. And then the Assure Competent Workforce. Like I had said, we're trying to develop something really great with the academic institutions because they have a trained workforce. So has anyone ever, or does anyone know or not know that you have 3 different tiers of public health traineeships in academia? So you have your Bachelor's of Science in Public Health, you have your Master's of Public Health, and then you have me, you have your Doctor of Public Health. That is actually relatively new in academia. Probably within the last 100 to 150 years, public health has been catching a lot of flack. In the medical literature, you'll find some pretty funny articles debating back and forth between physicians and public health practitioners and talking about how the DrPH is not as valuable and it is valuable. So I don't blame people for saying, like, who are you and what are all those letters behind your name? I get it. The alphabet soup. But we have a charge to be able to implement these 10 essential services because public health has been able to improve the lifespan from 47 to 77, 79 years of age on average because of the interventions that we're able to deliver, which involves the middle piece of the wheel. It involves a lot of research, and you have to have good research and good practice in order to make sure that you're really making change, an effective change in the community. Yes.
Could you speak to the issue of affordable housing and health outcomes? Or are you getting to that in the future? It seems like it's one thing to have a competent workforce, but if they can't live here because there's no housing for them, very low inventory of workforce housing, that affects health outcomes.
Yes, so I've been very fortunate to get invited into people's own spaces in their own areas. And some people are like, well, what are you doing in my domain? What's the relationship? And this is one of the big relationships is housing and health. And I've published some extensive literature myself in this domain. And when I spent time in California, I actually got to sit on some advisory committees to talk about housing and health. And we were able to make connections with zoning and building and planning to talk about these things and how to design spaces that are affordable and also that are going to be conducive to health. I want to get to that. I've had talks with Ken Bukes. He sits on the planning board. I hope he doesn't mind that I'm mentioning his name on TV. But he and I have had talks about these things. I'm actually going to a meeting in 2 weeks to talk about accessory housing and how can we make it affordable and how can we make it to where people know that this is something that's available to them and it's not going to ruin their pocket, because I think it's like people spend almost close to 50% of their income on a house on rent. It's crazy, and that's a conversation we should be having. We should be talking about what that does to them. So if people are prepared to listen to that talk from a public health perspective, I'm there. and then being able to have the board involved in making some policies to really have something to stick, so that way we don't see large fluctuations back and forth and we don't see more homeless people. I've seen it happen. Like I said, I was in California and I was in Oakland, and you've seen it to where people can't afford their homes, and then their health is deteriorating, and then the next thing you know, you got a hepatitis A outbreak on the street because everyone's sanitation is down the, I don't want to use a bad word here, but but you get where I'm going. So it's all connected, and we have to have this mindset of thinking like, well, what's the end stage? What's the outcome here, and what could this do for disease? So that's a very good question. Thank you. So please feel free to interject. So with that being said, the programmatic functions that are associated with that will, this actually complements that, because on the outside here, it talks about the capabilities that's also predicated on those core functions, because you got to have good assessment capability, you have to have good policy development, and also you got to make sure that people are engaged and involved, so that way they know, okay, this is what's going on, and I can be competent, and I can get involved in the process as a key stakeholder. Now, the middle part, those are the key essential programs that have been highlighted throughout the public health literature. Some of those things we're not providing right now. It's unfortunate, but I'm trying to get us there. I really am. But right now, I can tell you the environment and also community health or communicable disease is a big key thing here. Now, the other things, those are, I would say, the public health 2/public health 3.0 type things that we really want to try to get to in the town of Plymouth, because your healthcare system, or our healthcare system, does a good job, but we got a lot of gaps we have to start to fill in. We have to use data to really address these things, to build these programs, and like I told you earlier, I can assure you all that I'm trying to make sure I provide that data, and we can build on those programs right there. And then, so here in Plymouth, I've had a lot of people who are like, what is the social determinants of health? Let's talk about this, let's talk about this. And really, to be honest with you, this is where the Board of Health really comes into play. And this is where participation from the public comes into play, because all these things right here, things that no one wants to really associate with health, even, I mean, the people who know about public health, they do, but your everyday person, who is just going about their business and thinks about things in a fixed mindset, they won't think about these things. However, we know that housing impacts health from the standpoint of affordability and also where it's located. There have been plenty of studies that talk about where your zip code is matters. I would be willing to make a study that says, that says where your precinct is, it matters about your health as well. And the school system has been extremely huge in really recognizing this. Like I said, we are really about to make some huge strides. We're developing some education materials to start to address adolescent health in the Plymouth public school system, and we're also looking to get the families involved, because one thing is that we didn't really know, or the families didn't really know how bad vaping was inside of schools. And we really made a huge stride in educating people. They didn't know how people were getting access to that, especially people in low SES brackets. You would think, oh, I'm going to stop smoking, so I'll go and buy a vape pen to curb my addiction, when you're really feeding your addiction even more and exposing yourself to more toxins. And then what happens is that, and my Board of Health really, they understand, they notice, what happens is that we don't have a good policy to protect and prevent against that. So if you're low SES, which is a strong social determinant of health, if you don't have a good policy to protect them, we are essentially putting people more at risk. So there's a charge in public health that's very similar to being a physician, saying that I shall do no harm. And in the health education and health promotion realm, there's actually a code of ethics that we have to follow. And this is one of them. So when we're out there talking about things, it's like, well, do we care more about the dollar, or do we care about more about people's health more? And there's a balance, as some people would say. Since sometimes there's not a balance when you have good research that shows, for example, if you raise the age of vaping to 21, it does absolutely nothing to anyone's economic viability. So you don't have any economic gains from it, and you sure don't have any economic woes or negativity from it. So that's a policy that makes sense. But again, like I said, this really depends heavily on a good Board of Health to make this type of decision. And they're considering it right now after we had that big turnout a week ago, I believe. And I'm really trying to incorporate this through a health literacy program. So meaning that the library director and I, we're having a meeting tomorrow morning, and we're going to be talking about how to incorporate this in the health literature so that way people can understand what does this really mean, and is it what I think it is? And we're going to try to measure some things in terms of making sure that we're delivering good programs, because right now, like I said, we don't have data to support a lot of stuff that we do. And for me, that means getting engaged with community-based organizations and working with them on their own programming to say that how effective is this in the town of Plymouth for the target group you're looking at? Because what often happens in any community, like I said, Plymouth, this is nothing specific to Plymouth, but in communities across the country, is that you get people or organizations that will go out and do programs, and then they'll make people feel good and everyone's all happy, but then it's, oh, what did the program actually do? And then, was it cost effective? Was it even efficacious? And then there's this thing called fidelity, where the people who were doing the program doing what they were supposed to be doing in the first place. Some people may run away from it because I'm going to be really making sure that we're giving people in Plymouth the best that they have. But that's what I believe in. I really believe in giving people in Plymouth the best from a public health perspective. And then going about it through this will be one way. Yes, Mary?
Could you elaborate a little more on that big meeting you referred to at the Board of Health?
Yes.
A week ago with young people?
Absolutely. So this big meeting, as people like to call it, even though the room was small too, so not that small, but it was sizable. So I'd be willing to say we maybe had about 40 people in this room, in the rope walk meeting room. And so what it was is that I was interacting with a lot of the adolescent population about vaping through the Plymouth Youth Development Collaborative. And we had board members that even come and listen to some of these things amidst the crowd. And people were very shocked. And they were like, what do we do? What can we do? And I've said it before so many times, we have a board of health. They're like, huh? I'm like, yes, we have a board of health. And then so essentially, some of the people were like, well, can we come to the meeting? I'm like, yes, you can come to the meeting. And it was really I won't say my ability, but it was really my responsibility to foster that conduit because people were actually scared to come. The children were scared for a minute. But I assured them that the board is very open to this, and I'm here with you. And so I thought it was going to be maybe 10 kids who were interested in it from the civics class. And lo and behold, like I said, there was probably maybe about 25 to 30 kids that came to this meeting, and they sat. It was probably almost like this. A few more. They sat on the side of the room with the benches, and they looked right at the Board of Health members, and they started to talk about what they cared about and what the board do. Very poignant questions. I felt like I was in a Senate congressional hearing or something, and they really did. They gave the board something to seriously consider, and they are the future. So it's like, wow, how am I going to impact that? And the questions that were asked were very strong questions. You thought you were talking to someone in their mid-30s or someone who had super knowledge about stuff. And the other beautiful thing is that you had community members that were in there as well to even validate some of these concerns. Because when you're a kid, you think, oh, I'm going to get in trouble when there's an adult speaking, but that wasn't happening at all. There was community moving in concert in the Board of Health meeting. It was a beautiful thing. It really was. Yes, Don.
Nate, could you give some examples of kinds of questions that were asked?
Absolutely. So one specific question is that, and I'm kind of paraphrasing here, is that one student or child asked, what are you going to do about how this law is impacting my health? Because people are coming into the classroom and they're secretly vaping, or they're going into the bathroom and they're vaping away. And what's happening is that they're being a distraction in the classroom because they're always getting sick, or they're encouraging other people to vape that would have never, ever vaped. And they're going to the school nurse with issues of nausea, some vomiting because they're indulging in it too much, and even smoking marijuana in these vape pens. So the question was asked, and there were various answers that were given. One great answer was that, hey, I really understand what you're coming to me with, and this is something that we want to look at further, and we need to consider it. Another answer that was given was we have to balance some things here of the constituents, and that's a very good question. So you had varying answers, and it's open meeting law. It's open meeting, so I'll say as much as that. But that was one of the questions, and the other question is that do you know what is going on? Very simple, and an answer given was no. Can you tell us? And some of the board members knew what was going on because they were engaged with other community members. So those are examples of the questions right there.
I'm wondering if I is this on?
Yeah.
If I can add something to that. I'm one of the members of the Board of Health, and this meeting was absolutely overwhelmingly positive, but also the kids didn't let us off the hook at all, not at all. And they also asked us whether or not we had educated ourselves. How much do we actually know about the problems in the schools with vaping? And those weren't questions that some of the board members actually anticipated getting. But I just want to say I can't call this the lighter side, but what we were hearing, and the kids stayed for this, on our agenda, was a smoke shop in Plymouth that was trying to get remediation from their fine for having sold cigarettes to minors. And that was on our agenda prior to knowing that the kids were going to be coming for public meeting.
Yeah, no one
And
knew.
I'll tell you, the two men that were sitting there waiting for the agenda to start kept thinking, this is not a good day for us to be here.
And I will say that the board really set a good example by holding up the regulation for this individual who wanted to get a variance request, to send the message to say that we're protecting adolescent health if you're going to sit and sell cigarettes to someone underage. So that was a huge win, I think, for everybody. And this is a discussion that we're going to continue to keep having. This is where I need the water, excuse me. So this is a discussion we're going to keep continuing to have because the new law, as one of our all-star citizens pointed out in the room, has caveats to it that is proposed at the House. So essentially, it's a grandfather clause. If you're born after a certain date, and if you're 18, you can still smoke and not have to worry about being 21. Whereas if you're past this date, you have to wait until you're 21. So essentially, you could be hanging out in Plymouth at 18, smoking it up, and roll around to the high school, or give vaping pens to your buddies, while your friend who was born a few days behind you is like, well, I can't smoke anything illegally. So it's very, very interesting. But that's something that we're looking to change here on the local level. So if this will work. My slide does not want to work. Oh, there it is. So I've heard a lot of people say that, oh, we have a reactive culture. We have a reactive culture throughout the town. And public health has even been very reactive in the previous years past. And we've all seen data dumps. We've seen people use flashy numbers and say, well, look at this percentage. Well, public health is data-driven. It's not just data presentation. So what I'm saying is that we're looking to make a lot of decisions. Oh, you're fine. We're looking to make a lot of decisions in everything that we're doing based on the data. So that means if there's a septic issue in White Horse Beach, we're just not going to go out and look at it and say, yeah, it looks like a cesspool to me. Okay, yeah, that's it. What I'm saying is that we're starting to analyze we're bringing in a lot of this data, and soon we'll be able to analyze it, and we're going to be able to define risk areas. So that way we can advise homeowners on, hey, you may want to consider this type of septic system and also work with the engineer. So I am happy to say that we've had a conversation with the engineers, and we've talked about putting in innovative systems around the town of Plymouth. So they're very open to the idea. However, it is costly. But there are grant programs that are out there that we could try to aspire to obtain, but you need good data to do that. You need a compelling case. So I'm really looking forward to trying to do that. That's going to take some years to do, as there's been a bevy of data that has been in the department for septic tank issues and a bevy of problems. So again, I have to give kudos to these 5 brave students. They don't know it yet, but there's a lot going on in Plymouth. And we're really going to jump us into the 21st century in a very short time that they're here in the summer, but they're working very fast, very hard right now. So I'm really looking forward to actually using the data and not just showing you guys fancy numbers. So that's the reason for this chart, because we have Plymouth school data that we're going to use, town of Plymouth data, and also complement that with the state of Massachusetts and really say, where are we or where should we be? What standards should we actually set based off of these metrics? Yes?
Sorry, just a quick question. Yeah, what definition are you using for cognitive health?
So the definition that I'm using an operational one. So I'm looking at, when I'm looking at my data, I get to see who has what type of cardiovascular issues, and also seeing who has what type of cerebral vascular issues. And I'm basically saying, like, well, okay, if you have one or more of these cerebral vascular issues and you're impaired, based off of the narrative that I'm seeing in the mortality report, then I'm able to say that your cognitive health is declined based off of those cerebral vascular issues. So it's a very primitive right now operational definition. Like I said, I haven't published it quite yet, but I'm looking at how people are performing relative to their age, essentially. So now, again, back to using the data. So I have a 3-step process that I'm implementing right now. So the first process is this: engaging in a dialogue. I strongly believe in that, as you guys have heard me say a lot of times. And then step number 2, understanding what upstream policies are impacting the downstream outcomes. And then step number 3, we're really trying to get to leading to those optimal downstream outcomes by engaging and understanding step 1 and step number 2. This is an iterative process that's going to take a long time to build a culture within the town of Plymouth that was not there before. It's a very simple iterative process. So it allows me to not become frustrated during this whole ordeal of me being your director for public health in the town. So I briefly actually had a discussion with somebody in here about this article, and I had asked to see if they've read this. It's a very good article, very short, but if you're a public health scholar or health scholar, you know about this heavy, because in the health economics realm, we always know that when you implement public health interventions, you save money. You can't beat it. You at minimum usually see a 2-to-1 savings on anything. Why we aren't using it, that's the big question. Why aren't we spending more on public health? I think that's a question to put back into the community, especially in a local community that uses things such as town meeting rather than a ballot box. And we have to talk about how do we view and look at public health. And I remember I was talking to so many different committees at one point in time before town meeting and saying that, well, if my revolving fund account doesn't get approved, which it didn't, I would be creative. And public health has to be creative, because usually when we want to put in money into certain things, we want to see projects realized immediate. So I get it, I understand. But we need to start thinking about how are we spending money throughout the town and spending it on things when we know that if we put just a little bit more money into public health, so no, I'm not asking for a bigger budget right now on TV, but when we put a little bit more money into public health, we know that we can reduce and eliminate other things, such as people utilizing more services or children utilizing more services in your schools and putting a burden on the nurses, or you have issues in the community and your police force has to work more in overtime in your fire department too when they're responding to things dealing with the opioid crisis. We do know that when you educate and implement those interventions on that primary, secondary level, that people are going to be more prone to adopt them, but we can't even do that right now. So my big worry is that, of course, if we're not getting the money, then how is it impacting the budget or the cash flow in the town? Yes.
Hi, Nate. Pat McCarthy, Precinct 5. I hope that you're going to bring that revolving account back to fall town meeting with more specifics as to what where you're going to get the fines collected, and exactly then what you're going to be doing with that money. I think that was the big question that
Right.
FinCom had in terms of, not, pushing that ahead. But then, you know, we certainly, at caucus meetings, you could be lobbying and maybe, I would think, get that through. It seemed like a no-brainer to me, but what do I
Right.
know?
Well, you make a really good point, because one of the things is that, you know, in my mind, I believe that I'm a very nice, trustworthy person. So being able to engage, you know, that's one of the principles that I wasn't able to really get at. I did have a lot of stuff going on because I have a 1-year-old baby girl, oh gosh. And being able to get out and engage with the public wasn't there. So I do agree with you in getting to those specifics, because I need to understand what do people care about and to make sure that I don't infringe on that. That's one thing public health has to be very wary of and cautious of, because public health law teaches you once you infringe on people's own civil liberties, you lose them, and I don't want to lose the people in Plymouth. So one of the things about public health is that your health equals your wealth. Without it, you can't do anything. And then sometimes when you get into the tertiary phase, it can be too late because disease progression goes on even further, and you wonder if maybe if you would have gotten out in front of it, would you have not been going through such things to make your life course a little bit more enjoyable, I guess. Because let's face it, we're living longer, but quantity doesn't always mean quality. And that's one of the tenets of public health that's really starting to be looked at a little bit more, is how do we give the people in the public a better quality of life through public health interventions. So that's one thing I'm trying to do. So there's a lot of things I'm trying to do here. But the main thing is getting the public health department functioning, to be able to demonstrate to you all that it's a department that is worth a little bit more notoriety in terms of having a culture of health in the town. I've seen it in other towns and other cities across the U.S. When you have a good public health system, everybody wins. So without that, if there's any other questions, I definitely want to open up the floor. Don, yes.
Nate, I have no doubt in my mind that you're going to get all of these things done. However, my curiosity is how are you prioritizing, and can you share with us what your more immediate priorities are so that we as civic organizations can help you?
Absolutely. So I can definitely tell you right off the bat, environmental health concerns as it relates to the natural and built and social environment, meaning the septic tank issues that we're having right now, that's at the forefront. Because we, and I have to be honest with you, in previous years past, we haven't had a good way to understand how these septic tanks are impacting people's livelihoods and their health. And I feel like I have to make up for lost time that I didn't really have an involvement in, but it's at the forefront of my issues and priorities, forefront of my priorities here in the town. And looking to try to evaluate our regulations with the Board of Health to see, do we need stronger regulations that's going to give people that assurance to protect them? Because if you think about it, if we're not looking at how our septic tanks are impacting the people's health in the full scheme of things, we're doing a disservice. Because if there's a high nitrate load near a well, or if there's fecal matter runoff coming from a cesspool near a food source to impact our aquaculture, that's on me. And I don't want you guys to look at me and say he's responsible for that. You know, I really don't. But I don't want to see anyone ill or sick for something that I know I could try to help prevent. So that's number one. Number two, it is adolescent health. I really do believe and feel that the adolescents haven't had a voice across America. I mean, you're starting to see that now. And people in the 60s, you know, were able to have a huge voice, you know, going out to Woodstock and saying my rights this and everything like that. And it's like that all went away. It's like, what happened to that? And I think the youth who are involved in civics, because we all know that civics education and erosion is going down the tubes amongst our adolescents and people even in my age category. I'm in my 30s, and I talk to some of my colleagues. They don't want to get involved in the civic process, and it's terrible. But I really feel like if they look at their health and seeing how they're being impacted, I think we can make a huge change. So they're my second priority. And then my third priority is really looking at policy just in general here, and working with the Board of Health, because that relationship between the Board of Health and the department has been eroded. And the prominence of the board and the department has been eroded so bad. I really feel like, some things are just out in the wind, and when there's a health issue or a crisis, no one cares. But I think that's changing for the good. So those are my top 3 priorities right there.
So how does the field of push to legalize recreational marijuana fit in with one of your priorities, adolescent health,
Yep.
or the health of all citizens?
Yep, absolutely. So in side conversations that I've had with youth, they're like, Dr. Nate, they're like, how do we stop people from using opioids or even marijuana in vaping? And I told them, I said, well, that's something that the Board of Health has to look at. And that's also something that I have to look at from a health education and promotion standpoint. How do we design some educational materials that actually educate people on some of these effects that they may not really understand? So it really does. It fits into my policy and also the social environment piece when I'm talking about the environment in general. Because a lot of people don't understand that when you have access to something in your environment or you don't have access to something in your environment, it really determines a lot of your health outcomes. I know that the Board of Selectmen, they did very well in looking at how to put marijuana shops in light industrial. That's great, but still though, people are getting this stuff in their schools, and then we don't have a strong enough enforcement mechanism through the department right now to really hamper on that. It's unfortunate, but we don't regulate vape shops right now in the town of Plymouth. So that's how it fits into the policy and the environment piece.
So that's any age you can vape? There's no age restriction?
So I'll say this to be very distinct. You can go into a vape shop, unless that vape shop says you must be of a certain age, you can pick up vape paraphernalia if you wanted to. So that's going to encourage you to go and vape. Yep. Yeah, I know.
I have the mic. I know there are other hands, but I get to speak, and thank you. I want to address youth rather than adolescents, because gun violence in schools occurs often at the high school level, but now the middle school level, and we know from Sandy Hook, the elementary level. And I want to address also the notion of stress as part of the cognitive mental health continuum that youth are experiencing. And I'll give the example of a number of years ago, I had the opportunity to speak to an assembly of 6th and 7th graders about climate change. And I asked the question about greenhouse gases. And to my astonishment, more than 80% of them knew not 1, not 2, but 3 greenhouse gases. And this was 6th and 7th graders, and this was 8 years ago.
Where was this at?
It was in Medford. Youth are aware of a great many things, so your emphasis on adolescent health and vaping and marijuana makes a great deal of sense, but I'm wondering about what concerns you may have or what you're hearing in the town about stress that youth are experiencing in other categories.
Very good question. So among the many things that I'm actively doing, I'm working with the schools and looking at some data. We're re-reviewing the Community That Cares survey data to really look at some things that weren't previously addressed, to include stress. So from my perspective, I call it allostatic loading. So imagine you get accumulation of things all the time, and you ask, hey, how are you doing? I'm doing good today. No, you're really not doing good today, because you have all these other stressors going on in your life. So with this data that we have, I'm able to actually understand that. So when they designed it, that's a good thing. So we're going to probably start having a conversation about stressors in a way that talks about these things. Because again, this goes back to the cognitive health conversation, because all too often, I believe that with my interaction, children think when you say mental health, they're like, oh, you got to have a crazy problem, or you got to do something to say that, oh, something's wrong with you. But it's about what are you experiencing and what are some factors in your community. So that conversation will start to be had from a cognitive and behavioral health perspective, yes.
Is the nuclear plant considered a health issue in any way?
So I made a very good thorough visit to the nuclear plant, and You know, I will acknowledge the errors that were made, right? I will definitely say that. But I took a tour. I asked some really good questions in terms of what would you expect to happen based off of your errors, and what are you doing now? You know, because we all know the safety record was a wreck. And when we looked at everything from the water system to the air system, and then also what would happen in the event that someone came and did something terroristic, it's very low. It really is. Now, if they're handling the stuff, the rods themselves, and something happens, I'm very concerned. Yes, I'm very, very concerned when it comes to the actual disposal of it. And then in terms of the evacuation of things, we're going to have to reevaluate that and have a conversation, because, I mean, based off of the public opinion and also the input, that's something that we probably should have more conversations about. We shouldn't dismiss that, because we all know if something were to happen, it's not good. But I don't want to instill fear into people either. That's not productive, but we need to talk about a solid plan that we all can come to grips with if something were to happen. Yes, it is very stressful.
Hi, just a couple of clarifications and a question to you. One is that there is, in fact, a state piece of legislation that mandates that civics classes should be reinstated. And that's before the Senate right now.
That's
it's
good.
only in the House. But they have to sort of get together on the two different versions of that. But obviously that would have a major impact upon maybe some of these health-related things. Another clarification is that nicotine addiction, which follows directly from using vapes in the schools, greatly increases the chance that people who do that and get addicted to nicotine will also eventually have a problem with opioids and also with alcohol. And so that's another issue that ties things together. Finally, just a question to you. I wonder if you could comment some on what you think are the major medical problems or health problems in Plymouth, the things that actually seem to be more of a problem in Plymouth than they are in other areas of the state.
So, yes, so the data that Dr. Potvin is referring to is some national data that was actually discussed. And it is very real, and it is concerning because the use of this vaping device may be one of the biggest public health struggles for people in the age range of 12 to 17. So thank you for clearing that up. And so the big health problems that we're seeing in Plymouth, I said it earlier when we're talking about cognitive health problems. It's growing at an alarming rate. When we're talking about leading causes of death, and that's followed by cardiovascular disease. Cardiovascular disease has always been a big deal in the past, probably 20, 30 years, followed by motor vehicle accidents, actually. And then in terms of other infectious diseases that doesn't lead to causes of death, Lyme disease is huge here in the town of Plymouth. Hepatitis C is very huge in the town of Plymouth. And let me see here, what else is the other one? Because the data actually is going to be available to me in 2 weeks. So actually I will be able to comment on it. So if that's something that you all want to see published, please let me know. That I will have that information. We'll actually have a breakdown of it so that we can see how relative is it to you based on your age and some of the things that you may be exposed to. But does that help a little bit? Okay.
I think diabetes is also a considerable problem.
Yeah, diabetes is huge, and you see that lumped up sometimes in cardiovascular disease. So yes, type 2 diabetes, which is very much so preventable, is up there.
Okay, a question about learning from others. What other states might approach public health in either as well, or we could learn from, and or other countries that what they do well, and we could learn from?
So definitely have to say, surprisingly, Ohio is very good. So one awesome thing that's starting to happen across the country that Massachusetts is starting to catch up to is public health accreditation. So it's called FAB, P-H-A-B, Public Health Accreditation Board. So they're looking at how well is your public health department staff relative to your population, and then how well are they credentialed relative to their academic accolades and also some of their own work history. Ohio, the governor, which has done a phenomenal job of ensuring that all their public health departments have met accreditation pretty much for the most part. And they've implemented strategies largely through academic public health models. They have schools of public health that they draw students from, and they make sure that they're into the workforce, doing what they are trained to do. Michigan's pretty good. Parts of Texas are very good. And let me see, who else is another one that we could really look to. I would have to say those are the other ones. I can't think of any more off the top of my head without thinking about some other things. But strangely enough, even though my home state, my original home state, gets a lot of flack, Arkansas does a pretty good job with some things in terms of public health. But the thing to remember is that we have a decentralized system. So 351 municipalities, 351 departments or boards of health, that's really challenging. And that's why there's been a concept to talk about regionalization, even though that's often seen as a dirty word because people are like, well, don't mess with my resources, I'm going over here. But it's, hey, you're here to benefit the people in the town. So those other states that I mentioned, some of them have a good regional model too. Now, in terms of countries, Europe is good, and we're looking at the whole country. And then who else? So London, Britain. Britain has a pretty good system, but you got the NHS heavy over there. I mean, if we had something like the NHS, we'd be doing remarkable things. So I point to them all the time when I'm talking about international stuff. Mm-hmm. Yes.
Hi. This is a whole other new topic, but I think it's probably the current crisis in Plymouth. And it has to do with recycling and
Yes.
trash. And I was at the hearing, I shouldn't say hearing, the presentation when ABC presented to the selectmen for that hour, and I know you were there. And so I've kind of followed over the last few months what's been going on or not going on in the recycling. So I'm just going to raise a few concerns
Please.
and questions. And I did talk to Karen Keene today. So in terms of the private haulers, and you are the licensing agency.
That's correct.
And so I know you're excited about that this week. So in the list of private haulers, and my big question has been all along, what do these private haulers really do when they pick up the little bin of recyclables? I know they're all contaminated, whether ABC was doing curbside or whether people are putting them in the transfer station. The education component is huge. And I've spoken to Claire from South Shore Recycling Cooperative, and she was at that same meeting that couple weeks, seems like months ago, but like you said, 2 weeks ago. And in terms of the role of DEP, the licensing agencies, the contamination, reducing and reusing and getting people, I don't want to point out your water bottle, but I will, since Claire pointed that out again to me today.
Yep.
When I talked to her, and containers and all of that, because as we move forward in choosing, and I have the statistics from JB of where he has been able to recontract some of the services,
Mm-hmm.
and the separation of recyclables. And Claire couldn't tell me any company, private haulers she knew about from this whole region that really do curbside separation. Because if I'm gonna, obviously I'm gonna drop ABC because they're only gonna go on a 3-month cycle of renewing. So, but to get to separate,
Right.
and to save it's all about the environment and not to tangle up the processing machines and people that put hoses in their recyclables and all plastic bags and how they break down the processing machines and, the metal caps that are on the jars and it's all costly that when they have to take the cap off the spaghetti jar.
Right.
So all of those things I've been learning the last few months as I've read about China and why they're not taking because of the contamination and the environment. And all this,
Yep.
And I don't think the public, on Facebook today, as you saw, all they cared about, why did Plymouth do us in? Well, they don't know, all those they didn't watch,
Right.
don't watch them. On the agenda for months in the executive session is Viola for the sewer and ABC. So there were huge legal issues.
Yep.
And so I just am raising these concerns because as everybody comes to town hall to figure out what they're going to be doing, and it has to be, to me, a better solution for people than what we're doing, and about imposing the fines or, random checking of the recyclables that are going into these, XYZ truck that's coming through, and they only have one truck. So how are they recycling? They're throwing it all in the one truck. At least we had an ABC recycle truck. There was a start. But when it went to $86 a ton from 10 when the first contract was signed, that's a big absorption. I mean, so just general comments that this is kind of my concern of this week. I mean,
It's a big one.
Because the town government here gets the rap for they don't know how serious the violations in that contract were. And a lot of people don't read the Old Colony, they don't look at Facebook, they don't on the internet, they don't look at your crosslinks. And I just want to make sure, do you have a cross-link, and I didn't check, to South Shore Recycling Cooperative?
Yes, it's been there.
Okay, and
since I got here.
I must say, I forgot when I was talking to her, but they have such good tidbits of information out there, videos, things that people, just to remind them of what not to do, what to do. So it's just an educational piece, and it has to do with the environment, so.
I really respect the question a lot because I feel like it's a question that's been long overdue for me to ask. I really don't tell you anything unless you really want to know the nitty-gritty details. I would have told you we're working on the private hauler program because we know that there are some issues with it. But since you asked me a pointed question, I'll give you some pointed answers. So you all need to know that the way that compliance was being done on that program was a piece of paper and check, 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 and you put it in the drawer and you wouldn't see it for a few months. And you wouldn't know who was doing what and who was being serviced. So I came and I took that piece of paper and I threw it away. And what I did is I created a database, and South Shore Recycling Collaborative came and we worked on some compliance issues. Now, we'll say that JB, John Beater, DPW Director, has really been good about trying to make sure that they're in compliance with the fine. However, the value of public health is that we monitor things. We really do, and we do good surveillance, and we try to understand where the issue's at, where's the bottleneck. So what happened is that not just for the consumer, but the private haulers weren't aware of their own impact. So we sent out some really good letters to say, come into compliance. People made some phone calls and asked, what do I need? What do I need? Because I was just told that I just need to supply a list. And this list needs to have names of people. But the list actually has to meet some really good standards, so that way we can see who's getting their pickup in certain places, and then are they being disposed at a certain location, and how often are they doing it? We've revamped that program. Now, unfortunately, because ABC, is going through their issues, we have more people trying to come on board as private haulers now. People think they're going to make a fortune doing private hauler pickup. I want the best for them, but the main thing is that the service has to be good. But in order for the service to be good, I have to make sure we do good surveillance. So when I had talked to Frank Mann in the newspaper about compliance, we had an abysmal compliance rate because, again, we didn't do a good job, meaning public health, of going out and educating the consumer and also the provider on how to make this program work. The curbside recycling, it wasn't really happening that well at all. It's unfortunate. And then when we look at some of the reports, sometimes the private haulers, they weren't picking up adequate amounts of trash like they say they were doing. It's unfortunate, but it's something that we need to talk about. You guys, you need to know the truth, and you need to know that I am really trying to make sure we're fixing it. And it's no fault of anyone in the office. I'm coming into something with my expertise to really deliver something for a town that's very large, because the priority used to be septic tanks, and that was really it. But now we'll also tell you South Shore Recycling Collaborative is a huge godsend for us, because we have an individual who's helping us with this program and to have better relationships with those private haulers, so that way they know how to be good actors in the system. And I'll give you a really good example. We had someone actually go out and monitor on the ground to see what these private haulers were doing. And we saw that a private hauler wasn't compliant, and they would go by some of the trash bins. They wouldn't pick up stuff. We saw them picking up the can and making it look like they were actually dumping stuff, but nothing was being dumped. We saw stuff commingled. It was atrocious, and it wasn't a good day in public health land. Yes.
So the list of haulers that's online right now
Mm-hmm.
could be, when people are rushing and calling all these places, because they don't post what they really do on their website. They don't tell you, you know, about the commingling or whatever. I'm not going to start
Right.
calling all of them, but some of this list might be diminished by in 10 days. I mean, it could not be. I mean, some of these places that aren't even, they have a little bin or something or a bag. You leave a trash bag out there and that's your recyclables. I mean, those of us, unfortunately, who have been recycling avidly curbside, the bin is huge. I mean, you know, and we try to follow the guidelines.
Right.
However, and I talked to JB about it, and he's way like with you about education. I mean, it's everybody got on the bandwagon, but we missed part of this bandwagon, like that example I used about the metal off the glass. I mean,
Yep.
I never thought about it, and cleaning and then the glass market, he had to switch. Luckily he switched the Beaver Dam
Yeah.
Road out of that glass hauling because it went up to $145 a ton.
Yeah.
And they went out of business right after he pulled the contract out for
Yep.
the town. So these haulers are going wherever, like the guy from ABC, you know, and I mean, ABC was in bankruptcy 2 years ago, and they pulled out, but I think that they're, you know, I hope that,
Right.
and they're still on your list.
Yeah.
I'm concerned about that.
Yeah, to be private haulers, correct.
Yeah, they're a private hauler.
Right, and you know the goal here when we're talking about this is not for me to paint a bad picture on any company, but also you know you said education, and I will tell you there is a planned meeting to engage with the private haulers to talk about some of these things, so that way you know we have a conducive environment to say that hey, this is what we found that is going on, and we need to make sure that you're on board to provide a good service to the people in the town that are paying for it. I mean. China doesn't want to take our rubbish anymore. And this is a direct result of us not being able to provide a service in terms of education between the user and the provider. And you all, you know, you get left holding the bag, you know, for lack of better words. But yes, to your point, I'm sorry, say it again now?
Holding the bag.
Oh, yeah, I didn't mean that. But yes, I'm planning to have a meeting with them toward the end of June, some of the private haulers that are coming on, and we'll see how that goes. But compliance is a lot better than what it used to be, and we'll be able to squash out some of the bad actors. I mean, and I get it, it's political, but I'm trying to get ahead of it rather than waiting till something like this happens. But I wasn't here, unfortunately, 2 years ago when things started to look shabby.
Well, I have one final question before I thank you. How does one clone you? Because what I have heard tonight, and I'm pretty naive in a lot of different ways, but I go into your office, I don't see too many people. So are you able to do the monitoring as well as the thinking and the planning and the meetings and all the rest of it?
So, you know, I do a pretty good chunk of it. I do. And I'm able to work in different places at different times because of the cloud. But, you know, I'm a big techno. I'm a millennial, so don't hate me for that. But yes, I try to stay on top of things as much as possible. You know, and I'm not perfect, but I'm really trying to make sure I give what I've been trained to do to a town that really deserves it. And people who need it, yes.
Well, we thank you so much. You've given us so much to think about.
Thank you.
I think The audience needs to know, though, he didn't bring that bottle.
It's not his fault.
I won't say who did.